Hi, this is Dr. Jeff, your advanced trained non-surgical spine specialist and chiropractor of 20 years. I'm also the author of Never Look Back, a simple guide to the causes and care for back pain. Why did I write this little book? Well, this 100-page book is designed to help you find out exactly what's causing the neck pain, what's causing the back pain. I find in the last 20 years that most people come into my office after seeing multiple different types of doctors, they still don't know what the cause of their neck back pain are. They don't have a diagnosis. So in this little book, one of the main things we do is we help you find out which tests are going to find out what's causing your back pain, and if your doctor's not running these tests, you should fire your doctor and find a new one. We also teach you the 5 ways you unknowingly are hurting your backs and necks every single day, and the 5 ways to prevent that. Those are just a couple of chapters out of the book. Again, I encourage you to get it. Neverlookbackpain.com is being built right now. Within a couple weeks, that site will be up. You can grab it. But enough about this book. Let's talk about how COVID-19 lockdowns could have increased your neck and back pain. So how could COVID-19 lockdowns increase your neck or back pain? Besides the stress of it all, let's talk about the biomechanics of it, right? So before the COVID-19 lockdowns, most of us were active. We'd wake up in the morning, get around, get some breakfast, get your coffee, get moving. Some of you would exercise before that. You get in your car, you get to the office, you're working, you're sitting, you're upright, you're moving, you're on your way home. Some of you go to the gym. You're on, the weekends you're moving, so at least there was some movement in your life. Yes, you were on your phones, you're on your computer, but there was more movement to keep you away from that stuff. Well, let's see what happened during COVID-19. The world stopped. You stopped going to the office. You stopped having to do some work for a while. Gave a lot of people a needed break from the hustle and bustle of life. But here's what we got caught doing for most of us. If you look here, we either got caught laying around, falling asleep in positions we shouldn't, bobbing our neck forward, sitting often in positions like we shouldn't, like you see here. We caught up on all the books that we wanted to read, right? So now we're starting to read books. The challenge is our head is down, as you can see in this picture here. Our head is down. And finally, a lot of us got into our phones at an even higher pace. We started playing games. We started reconnecting with people on Facebook. We had nothing to do all day, so the only thing to do socially was get on this phone, get on the computer, which caused us to do a major thing. And that major thing was bring our head forward, as you can see in those pictures. So you brought your head forward more potentially in COVID-19 because you got to relax more, you got to lay around more, and that forced the head forward. Well, how does that cause neck and back pain? Well, again, this head weighs 10 pounds. And biomechanically, if I turn to the side, when we have a nice curve in the neck, the head is over our shoulders and hips. And that's what creates a healthy locking in place spine. But guess what? Over the COVID-19 lockdowns, as you started to read more, fall asleep in positions more that weren't so right for your neck, or start to use your phone or computer more, you start to bring your head forward. Every inch you bring your head forward increases the weight of the head by an extra additional 10 pounds. Well, that puts a lot of pressure on the disc. Here's the disc. This is what the spine is supposed to look like if the head is in position. It's supposed to have 70% of the weight towards the back of the joints and only 30% of the weight towards the front. When your head starts coming forward, we start changing the pressure from 70% in the back to more percentage goes up front, and then you start squeezing the disc. That can create disc or discogenic disc pain, neck pain, back pain. You start stretching the ligaments and the muscles. You start causing an inflammatory process. Then you start pinching the nerves. So the COVID-19 lockdowns potentially for you, if you found yourself sleeping more, falling asleep in the chair in wrong positions more, if you found yourself looking at your phone more, if you found yourself catching up on all those books you wanted to with your head forward, if you found you were on your computer more, that drove the head forward, which increased damage to the spine biomechanically, which could have increased back pain and neck pain. So, hey, look, The COVID-19 lockdowns are pretty much over at this point. Now we're back to work, we're back to moving. In my book, I talk a little bit more about how you could have been damaging your spine a little bit more. But today's tip is if your head is coming forward and you're looking at your phone and you're falling asleep in those positions, potentially in COVID-19 lockdowns, that could have been the increase, potentially, of pain in your neck and your low back. What do we need to do to reverse that? One of the things you can do is just open your arms up and tilt your head back and stretch. Look up more. Look up to the sky more. This is Dr. Jeff coming to you from my channel, Never Look Back Pain. Please subscribe, like, share this. 80 plus million Americans are suffering neck and back pain, and I'm here to teach you how to reverse that. This is Dr. Jeff, the Midwest Disc Clinic here in Northeast Indiana. Never Look Back Pain. Free back pain tips right now. You can go to freebackpaintips.com right now. You can sign up for free tips and my monthly newsletter. Dr. Jeff, I'm an advanced trained non-surgical spine specialist. I'm a chiropractor and author. Please click, subscribe, like it, share it. I'm here to help you.